On March 27th, the Biden administration finalized a rule that would make it easier to apply for, renew, and maintain Medicaid coverage. The rule's got a long name. It's called Streamlining the Medicaid, Children's Health Insurance Program, and Basic Health Program Application, Eligibility Determination, Enrollment, and Renewal Processes. Now, this was a proposed rule back in September of 2022, but it is now finalized as of April 2nd, 2024. The changes would streamline eligibility and enrollment, and it would do it in the following ways: reduce red tape, ease administrative burden, establish more consistency across the states, overhaul the application and enrollment process, and make it easier for people to get and keep coverage. More specifically, there are protections in the rule that do the following: eliminate annual and lifetime limits on children's coverage in the Children's Health Insurance Program, end the practice of locking children out of that Children's Health Insurance Program if a family is unable to pay the premiums, eliminate waiting periods for Children's Health Insurance Program coverage so kids can access health care immediately, and improve the transfer of children seamlessly from Medicaid to that Children's Health Insurance Program if a family's income changes. Now, it's also going to require states to give all individuals at least 15 days to provide any additional information when applying for coverage for the first time. They're going to get 30 days to return documentation when they're renewing. It's going to prohibit states from conducting renewals more frequently than every 12 months, and it's going to prohibit states from requiring in-person interviews for older adults or those with disabilities. In a statement, the Secretary of the U.S. Department of Health and Human Services, Secretary Becerra, said, "We know that removing red tape and administrative barriers helps people get and keep their health coverage. It gives security and peace of mind to American families." And he continues, "This rule extends insurance reforms included in the Affordable Care Act so that millions of children will not face barriers to enrollment or be at risk of losing the coverage they rely on to stay healthy." The rule is actually responding to some executive orders back from January of 2021 and April of 2022 that focus on strengthening Medicaid and access to affordable quality health insurance. It's also building on what CMS has learned during Medicaid unwinding. They see that simplifying and streamlining eligibility, enrollment, and renewal processes keeps people covered. The changes are expected to impact about 88 million Americans. You could read more on that final rule. We link to it in the description below.